My question is, does blocking recruitment of MDSC in the inflammatory of pancreas affect regeneration? Can we stain to identify what cells are actually regenerating? Phew, that's a lot to take in. Now let's start off with a more simple question. Have you ever stopped and wondered, where exactly is the pancreas? This is where the pancreas is located. It is about 6 inches long and it sits across the back of the abdomen, behind the stomach. So technically you wouldn't really see it unless you do some serious digging. So what exactly are MDSC? It stands for myeloid-derived suppressor cells, and they are a heterogeneous population of cells that are precursors to dendritic cells, macrophages, and granulocytes. How is this all done? How can we figure out if MDSC are there and blocking? The answer can be found through histology. So what is histology? Essentially, it is a study of microscopic anatomy of the cells and tissues of animals and plants. These tissues are prepared using special processes called histological techniques. You probably have used a microscope to look at slides before, right? Histology is very important in education, research, diagnosis, forensic investigations, and more. It's a visual that can tell us what is happening in the cell via looking through a microscope. The tissue is dehydrated through a series of graded ethanol baths to displace the water. Here, I am taking it through 70% ethanol 2 times for 15 minutes each. Next, I will do the same thing but with 90% ethanol for 2 times for 15 minutes each. Now, continue with 100% ethanol for 2 times 15 minutes each, and then xylene for 2 times 20 minutes each. Next, I will take the tissue and transfer it to a small vial so it is easier for me to fill it up with paraffin or wax. It can be a challenge for the tissue to fall down, so I would invert it a couple times until it does. But if it doesn't, I will tap on the tube upside down until the tissue falls onto the cap. Then I'll get my forceps and put it into the vial. Take the vial and fill it up with paraffin or wax. Make sure to change the wax every 20 minutes for 3 times. This will allow the wax to infiltrate the tissue. After the 3rd time, leave it in the heat chamber overnight. The infiltrated tissues are then embedded into wax blocks the next morning. Pour it out into a mold and use a warm forceps to adjust its position. Next, put the holder over it and fill the remaining with wax. Then transfer it over to a cold plate to let it solidify. After it is done, it should look like this. Once the tissue is embedded, it is stable for many years. Next, I will bring it over to the microtool machine and begin sectioning. I place it in and adjust it to the right position, and begin turning this lever to get well-cut section called ribbons. I'll take my forceps and move it to the water bath so I can grab it with my slides. After that, I will take it and put it on a hot plate so the tissues can adhere to the slides a bit when I take it through alcohols and staining. Finally, there are many ways you can stain the slides. You can H&E it, which is hemotoxin and eosin, or do other antibodies and fluorescents to get specific cells to show up. The most common would be the H&E, and I am sure you have seen it before. Specifically for my experiment, I did a fluorescent staining. This is my result from my fluorescent staining. The bright lime green are cells undergoing mitosis. This means that there is proliferation, which means regeneration is indeed happening. My future questions are, if MDSC is blocked, how is that going to affect cancer progression? Is the cancer going to progress more quickly or slow down?